Hello, everybody. Good afternoon. We have a lot to cover today, so I'm going to skip the typical intro. I'm just going to say that in Imperial County, our most recent numbers, we've had 9,067 cases and 181 deaths, and our test percent positivity is a bit over 16%. So let me go ahead and get started on the questions. The first question is as follows. It is now more than 3 weeks since the 4th of July weekend. Have there been any discernible changes to the number of cases, hospitalizations, et cetera, that might be linked? In order to answer this question, I'm going to turn it over to Chris Herring.
All right. Good afternoon, everybody. Chris Herring, the EMS manager.
I'm sorry, Chris. Can I interrupt you for just a second? I need to start the recording. I am so sorry. Give me just a second here.
This call is being recorded.
You're good to go. Thanks, Chris.
All right. Let me quickly reread the question then. It is now more than 3 weeks since the 4th of July weekend. Have there been any discernible changes to the number of cases, hospitalizations, et cetera, that might be linked? Go ahead, Chris.
All right. So Chris Herring, I'm the EMS manager with the Public Health Department. So following the 4th of July weekend and about the week and a half, 2 week mark after that, we did see a slight increase in our hospitalization rates. Those numbers have since stabilized to a point where our hospitalized cases are decreasing a little bit. We still have more than 80 hospitalized COVID patients in our hospital as of this morning. It'd be a little speculative of me to link it directly to the holiday, but we did see that same pattern following each of the previous holiday weekends prior to the 4th of July.
All right. Thanks very much, Chris. Next is a request for an update regarding the prisons and jails within the county. And I will just say, before I turn it over to Adriana Ramirez to give us the numbers on the jails, that the prisons, of course, are state institutions, and the best place to get that data is actually on the prison website for the California Department of Corrections. I will note that on their website, they do note that in our state prisons at Calipatria, they've had a total of 53 positive cases in their staff, and in Centinela, they've had a total of 72. Looking at their inmate population right now, they note at Calipatria that they have a total of 24 active cases, 21 of which are in custody and 3 of which have been released. And then at Centinela, they note a total of 19 cases that are active, and none of those have been released. So I will now turn it over to Adriana so that she can give us the number for our local jails.
Good afternoon. My name is Adriana Ramirez. I'm the Maternal, Child, and Adolescent Health Manager here at Public Health. The current numbers at Imperial County Jail are 32. We've had 32 positive inmates. In the last 1 week, 2 have resulted positive and are currently in isolation. In regards to staff, we have 32 positive staff with approximately 6 being off of work due to being on isolation. In the last week, we have not had any new staff come out positive.
That's good news. Thanks very much for that, Adriana. Next, can you provide an update on molecular testing within the county? Have wait times in booking and appointments or getting results been impacted by nationwide shortages? And as the state's reordering of who to prioritize in testing having any noticeable impact? So I'm going to make a few comments, and I'm going to turn it over to Jeff Lamore, our Deputy Director for Environmental Health, who has actually been managing our testing process in the county. What I would say is the state's new priority list just came out and really hasn't had time to be implemented yet, so it's a bit soon to say what impact it will have. I would note that it's going to be necessary to actually take that list and sub-prioritize it because it's still, for example, in Category 2, has a large number of people, and if testing capacity does worsen, it will be difficult to provide it for everyone. So we will continue to prioritize. We continue to have our 4 Optum served lanes, 3 sites, one of which has 2 lanes. We have had the National Guard lab assisting us. Unfortunately, we will be losing them at the end of the month. We're very appreciative of the help that they've given us. They've worked really, really hard, and they've done quick turnaround testing for us, which has been very, very helpful. But unfortunately, they need to leave. Their deployment time is up, and they do certainly deserve a rest, and I'm sure that they will then be deployed somewhere else. In the meantime, we'll continue to have the OptumServe sites for the time being, and we continue to have our internal capacity testing at the health department, as well as the state lab at VRDL to back us up. I'll turn it over to Jeff so he can discuss the impact of the shortages with regard to what's happening at our OptumServe sites. Jeff?
Thank you, Dr. Monday. So with our OptumServe sites, right now, given all the 3 sites, the 4 lanes are actually being underutilized at this point. We're not hitting our scheduled capacities at any of the 3 sites. So with that, there's availability for someone to actually make an appointment and be seen the same day. So we have that available to us. As far as any delays with regards to either supplies of test kits or testing results, the state has switched over specifically for Imperial County to a group called Let's Get It Checked. That is, so we have ample supplies of our test kits, at least for Imperial County. I believe some other jurisdictions are also using Let's Get It Checked, but Imperial County specifically, we're not seeing a delay in the supplies. As far as the testing results, the state has made some comments to our leads at the testing sites that it could be as far as the results could be delayed as long as 3 to 5 days. But as it currently stands today, we're seeing results within 2 to 3 days. All
right. Thanks very much, Jeff. Next are some questions for Tony Rohotis and perhaps some staff. The first one is as follows. With the majority of COVID tests coming from senior citizens, what programs and activities have the Area Agency on Aging done to support seniors that have been infected during this pandemic? If a senior has COVID, do they receive the Meals on Wheels to their homes? Tony?
Thanks, Dr. Monday, and that's correct. Yeah, since the beginning of this, we've had several programs through AAA in partnership with various different working groups from Imperial County, either reassigned staff from other departments or the National Guard serving meals. And currently the AAA is serving 815 meals a day to seniors through an emergency relief bag delivery and wellness calls. That's 815 a day. And those meals are available to seniors that are available to anybody 60 and older and are part of the program and have signed up. And this also includes seniors that could be positive with COVID at home as well and having the foods taken directly to their homes. As you guys are aware, we used to have congregate meal sites where seniors could go and get their meals during the day, but with COVID occurring and not being able to have congregation of people within a site, most specifically a vulnerable population like seniors, we've been distributing these amount of meals for several weeks and actually several months now.
All right, Tony, thanks very much. And it's great to know that we're doing this to help our seniors. On Friday, Governor Newsom announced a new program, Housing for the Harvest, provides safe temporary isolation spaces for agricultural and farm workers who test positive or exposed to the virus, which limits the risk for spreading COVID-19 to their coworkers or households. This program will operate in partnership with counties and local partners in the Central Valley, Central Coast, and Imperial Valley, the regions with the highest number of agricultural workers. Where are these temporary isolation spaces going to be located here in the Imperial Valley, and when will it begin? How many farm workers have tested positive for COVID-19 in Imperial Valley?
So this is Tony, and I can tell you, I can't answer how many farm workers. I do not have that stat in front of me, how many have tested positive. Maybe Adriana or Jeff do. What I can tell you is the county departments are meeting internally with this new program that was unveiled last week. Obviously in Imperial County, due to agricultural being such a huge portion of the way we live here in Imperial County and what this county thrives off of, we know this is extremely important and we want to take every advantage possible to make this happen. So internally we are meeting. I'll be also having discussions with our ag department and our local ag agencies such as Farm Bureau and Ivy, Imperial Valley Veg Growers Association, because this is something that's going to impact both sides, and we both need to be at the table to ensure we maximize the program that we're making available. I think it's also extremely important to realize that our Agricultural Commissioner's Office, through state resources, has delivered an estimated right under 500,000 mask to our local farming community, farm laborers, because they are, like I said, they are a huge portion of the industry within our county, well involved, and that's just a big portion of people we need to take care of and help facilitate any of their needs to limit the spread within that group.
All right, thanks very much, Tony. Lastly,
Dr. Monday?
Yes.
I think I can provide some numbers on farm workers testing positive, if you'd like me to.
Oh, thanks, Paula.
Paula Kreiner, Epidemiology Manager for the Public Health Department. We've had about 300 cases who have identified their job as farm worker or field workers, and these include people who identified their work as field truck drivers and field irrigators, as well as transport drivers. We've also had about 24 cases that have identified their jobs as packers, specifically produce. And that's
all right,
what
Paula,
we have
thank you.
So far. You're welcome.
Great, appreciate that. The final question for Chief Rohodes is, the county announced last Friday about this webinar of the funding availability for the Home Key program. Will the cities have to apply for this grant through the county, or will it be on an individual basis? Up to how much money a city or county can receive from this grant? Tony?
Yeah, so the CEO and Department of Social Services are assisting our local cities with information on how to apply for the funding. As mentioned, on Friday, we did host a conference call, Zoom conference call regarding the Home Key program. The cities are required to apply independently through an application process. And this application process will be done through the Department of Housing and Community Development. There's $5 million available to be distributed throughout Southern California, excluding Los Angeles. We are trying to maximize our application and do everything we can to get as much money as this as possible. We did meet with the cities individually. We think this is extremely important. We know that we need to utilize resources, and we need these resources to be available throughout Imperial County. And that's what we're stressing to our partners here in Imperial County, and seeing how we can apply and maximize and gain any potential dollars available for our citizens.
All right. Thanks very much, Tony. So the questions are directed again to the Public Health Department. The first is that Dr. Tomaszewski proclaimed the curve is flattening and thanked the public. By all metrics, does the Public Health Department agree with that assessment, and why or why not? What would make you think the curve is flattening if you don't agree? So I didn't actually get to hear Dr. Tomaszewski's comments, but I did get a chance to speak to him over the weekend. And what he told me is that what he was referring to was the fact that over the last few weeks, that the number of emergency department visits has declined at El Centro Regional, where he serves as the chief medical officer. He also noted that there have been fewer transfers outside of the county. And so those two things are, of course, both positive, and so that's what he was referring to. If you look at our cases, I don't know that we could say at this point in time overall that there's a big change, but it may be that the severity at least is decreasing. And so I do think that there is some evidence that we are moving in the right direction, but it's hard to make a trend over what's happening over the next couple of weeks. So we'll continue to monitor this, and we'll look at everything from the total positive number of cases, our testing percentage that's positive, and of course the parameters that we measure at the hospitals, like the number that visit the ED, the number that get admitted, the number of ICU patients, the ventilator use. All of those are things that we look at, and we use all of those to decide where we are going in the outbreak, because they all give us complementary information. Next, it says, why are the deaths looking like they're picking up speed and in larger chunks, even though the number of positive tests are coming in smaller waves? Paula?
Hi. So the increase in deaths reflects the overall increase in cases, and there's an expected delay in deaths, with some deaths occurring weeks or up to a month or longer after the individual initially tested positive. There's also a delay in reporting deaths. We confirm that the deaths are due to COVID-19 by reviewing death certificates.
Okay, thanks very much, Paula. So the next is as follows. Where are the deaths coming from? Are they happening in homes, hospitals, rehab centers in county, out of county? They are still concentrated around 60 to 90-year-olds, and almost 3/4 of those who are dying. Is there something more to understand about the nature of the deaths or the demographics? Paula?
So that's correct. About 60% of all deaths are in individuals who are 70 years of age or older, and many have pre-existing conditions such as diabetes, hypertension, or asthma, and some are immune compromised, which put them at greater risk. Older individuals, of course, are more vulnerable. Most of the deaths occur in hospitals, both in county and out of county. Some of the cases are among residents of skilled nursing facilities, and we've had a couple of recent cases who have died in their homes.
All right, Paula, thanks very much for sharing that information. So next the question is, can you share data for the week and cumulative for SNFs, jails, prisons? I would note that we've already discussed the jails and the prisons, so I will turn it over to Stephen Solis to give us the most recent data for our SNFs. Stephen?
Hi, good afternoon. Stephen Solis, Public Health Nursing Manager for Imperial County Public Health. There's currently 28 positive residents total and 29 deaths from all the skilled nursing facilities. Last week, 2 facilities reported 0 COVID-19 residents from our weekly testing. So yes, it has been improving, and the challenges remain with all skilled nursing facility staff being compliant to test on a weekly basis at testing sites and reporting them to the results to their supervisor.
All right, Stephen, thank you very much. The next question is, what are the transfer data for the week? And so I'll turn that over to Chris Herring.
All right, sorry, I was looking at the question for Jeff. The transfers for last week were in single digits for both hospitals, so less than 10 out-of-county COVID-positive transfers. Unfortunately, I have not received the updated report from the state for the cumulative numbers. However, the number still is over 600. It has not shifted significantly in the last week, though.
And in a similar vein, Chris, a similar question with regard to the ACS. How many patients and what's our cumulative total there?
Yeah, so looking at the alternate care site out at IVC, the current census, so the number of patients in the facility is 14. The cumulative total of patients seen since it opened on May 25th is 193. The average length of stay for the patients that have been out there is just over 3 days, essentially saving our 2 hospitals over 500 hospital bed days since it opened. The other part to the question there, the difference in who can be treated. If you guys all remember when we first opened that alternate care site, it was built off of a cache of federal supplies called a federal medical station, which essentially was cots with some mattresses and some pretty basic medical supplies. We've since increased the capabilities of that facility to operate essentially like a medical surgical unit in a hospital, so a typical hospital ward. We've been able to increase the oxygen supply for that facility enough to where it can now provide high flow oxygen to the patients that it has in the facility. That was the biggest limiting factor when we first started, was the oxygen requirements were pretty low. And that's the update on the ACS.
All right, Chris, thanks very much. Next, is the state satisfied with the local progression of the virus, or do state officials think local public health and government could and should be doing more? So first thing I would like to say is that we've been very appreciative of the assistance that we've gotten from the federal level through CDC and others, and also through CDPH and for the Office of Emergency Services. I mean, there's been great cooperation. A lot of the things that we have that we're using to respond to the outbreak, for example, the ACS that Chris just described, the National Guard assistance that we've had both in terms of the lab as well as the personnel, those have been assets that have been provided to us. And there are many, many more that I could describe and that we've talked about previously. In terms of whether the state is satisfied or not, obviously I think you would need to ask them that question, but I would point out that a few weeks ago that the governor did call us out in one of his press conferences and thanked us for our work and our cooperation. And so I feel like they feel that we are indeed working as hard as we can to try to take care of our county and to deal with this outbreak. So the next question has to do with community outbreaks, and it's as follows. I've seen other counties report what they've described as community setting outbreaks, bars, restaurants, private gatherings, stores. Can Imperial County provide its own breakdown of outbreaks? So Paula might have a few comments that she want to make as well, but I will say a few things with regard to that. The first thing that I would note is that we've not opened bars or restaurants, and we don't permit gatherings. So those are not really areas where we would be expecting to see outbreaks, and really haven't. Where we have seen outbreaks are in the places where you have seen them, typically in other jurisdictions in which you have large congregate settings. So our jails, our prisons, unfortunately our skilled nursing facilities that we've discussed, and then the other places that have also been seen in other parts of the country, for example, our large food processing and preparation operations. Those are where we have seen outbreaks. Paula, did you want to add any additional comments?
No, I don't think I have anything to add. Thanks.
Okay. So next, there's a question with regard to negative tests. Are workers in Imperial County required to show a negative test result after they have COVID in order to go back to work, or is each employer different? So I would say that we don't determine what individual private workplaces require for someone to return to work. So there is not a specific requirement that someone get a COVID test, and I would imagine that different employers do different things. However, that being said, there is guidance that has come out from CDC and CDPH that we have followed, and many of you are probably aware that I just revised my isolation orders to reflect this new guidance. And what the guidance states is that that testing is not recommended as a means to release somebody from isolation, except in very limited circumstance. And what they recommend instead is that you follow the amount of time that's passed and what symptoms they have. In most people, that means that if they are improving and they've had no fever for at least 1 day, and they have had symptoms for at least 10 days, then they can be released. For people that are more severely ill, these would only pertain to hospitalized patients. So if they're severely or critically ill, or somebody who has severe immunocompromise, so for example, somebody who had a bone marrow transplant or other similar kind of immunocompromise, then it's 20 days. So they have to be afebrile for at least a day. They have to have improving symptoms, and it has to have been 20 days since onset. If someone never develops symptoms, then for the mild to moderate illness, then it's 10 days from the time the test was obtained. And for the second category that I described, the people that were more severely ill or immunocompromised, but that never developed symptoms, then they would be 20 days from the time of the test if they never developed any COVID symptoms. So again, it's not required, and it's actually being discouraged at this point. And the reasoning behind that is that we now know that people, particularly the ones that are seriously ill or who have severe immunocompromise, that even though they recover from the virus and they no longer shed it, the viral RNA, which is what the PCR test detects, can still be there for months. And so it leads to confusion. So now that they actually have data that show that those people actually do not grow virus and therefore are not contagious, they've made these new recommendations. So in terms of when somebody could be contagious, which is the next question, is exactly what I just said. Once they've met these criteria that I just described to you in detail, and which can be reviewed either on the CDC or CDPH website, they are no longer considered to be contagious, and that means that they can go to work, they can be around others because they're not at risk of transmitting to someone else. The next question has to do with being reinfected. This question is starting to come up quite a bit. And I think in part it's because of what I just described with regard to the PCR testing and the fact that even when somebody recovers, that they could still be positive for prolonged periods of time. Can you get COVID again if you've already had it? have we seen any cases in Imperial County of people getting the virus multiple times? So the first question we don't yet know the answer to. And the second question is that we have not seen this, but at least as of yesterday, there's not been a single case reported anywhere in the world of a confirmed person being reinfected with COVID. So although it's a theoretical concern, it's not yet been seen. One of the viruses that's related to COVID-19, another coronavirus that we do see as one of the seasonal coronaviruses, is able to reinfect people after about 3 months. So since we don't have any information with regard to that for COVID, then what we are doing is following the guidance for a similar virus. And so what we do is we use the 3-month mark. And I won't go through all the details of this, but the gist of it is that when we have people that are being periodically tested, so for example, the staff in our skilled nursing facilities who get COVID and then get released and can go back to work, if they are positive within the first 3 months and they don't have any symptoms, then we don't assume that they're contagious. And that's not specific to a skilled nursing facility. I'm just using that as an example. After 3 months, since we're not sure what this virus does, if they came back with a positive test and didn't have symptoms, then we would do a very thorough evaluation to determine what to do. If they actually develop symptoms that could be consistent with COVID, then we would just assume they might be contagious and we would isolate them and quarantine their contacts just like we would have done in the first place. So it's a little confusing, but that's because we just don't have all the data on this virus yet. So that's the extent of the questions. We've got about 2 minutes or so left, so I could probably answer one more question before we close for the day. Does anyone have a question?
Yes, Dr. Monday.
I have a question. Oh, go ahead.
I'm sorry. Mario Conde from Beyond Board Gazette. I submitted a question about the
Mario.
Workers, so yes,
Mario. Mario, why don't you let the other person ask the question since you already had a question answered?
Okay, sure. Go ahead.
Yeah, this is Alex with KYM News. I wanted to ask, as far as like the prison and nursing skilled facilities, is the same what is being asked for employees at these facilities that have high risk, the nursing skills? Are those employees required to show negative tests, or does the same amended order apply to them?
You mean in terms of return to work?
Yeah.
Yeah. So what I just described to you is the same policy that they use everywhere. So, for example, on the skilled nursing facility call that the state had this past week, they specifically described these new guidelines with regard to when you can take somebody off of isolation and talked about how they would apply in a skilled nursing facility. And that's why I actually gave that as an example, because we discussed it on the call. So yes, they are following those guidelines. Now, an individual facility, just like an individual employer, may choose to do something different, but the state guidelines are to follow these new state guideline is to follow these new federal guidelines because, as I said, the testing, unfortunately, is very problematic. And now that we have data that shows that after a period of time that we don't have to worry about transmission, then that's why we've gone to these new criteria. Okay, so so that it's 12:31. So I want to thank you guys for another good press conference. Please stay safe and socially distanced. Have a good week, and we look forward to talking to you guys on Monday. As Fernanda said at the beginning, before next week's press conference, if you do have questions, we will let you know late in the week if we are going to focus on a specific topic, or if, like today, it'll just be open. But we will want to have those questions received by noon on Sunday so that we have time to prepare and get the right people involved to answer your questions. So thanks again, and everybody have a really good week.